October 25th, morning, about 7:15, just waking up. My little sister Carrie has returned, and we were eating cream cheese and toast and having coffee. Maybe some strong coffee today. We will test it. I'm trying to figure out, she's the first time piloting the grinder, so try it out.
Oh man.
What'd you do?
You want the handle on the other side? Or is that okay?
This is the hard part with the collar. That's pretty good.
Okay.
You don't think it's too strong?
Oh, I gotta try mine, right?
Yep. See, yesterday was kind of an exciting day. Let's see, the first thing we did was get up in bed. I actually was able to pull myself up with using a chain, just as basically like a loop chain that's tied to the end of my bed, and I can get my hand around it, and I can use my giant biceps to pull myself up and sit upright. And then, while I'm upright, then I was working on pulling pants on, so that was pretty fun and challenging all the same. But I got a new chair. I got 2 new chairs, and faster, lighter weight manual chair and a fancy new front wheel drive chair from the company called Quantum. The last company I had was called Permobile, which was F3, which is a front wheel. F3 is front wheel drive, and then before that I had an M3, which I was the one we were whipping donuts out in the snow. That's a mid-wheel unit, so it's got 6 wheels. The front wheel drive is more capable. It actually will climb up a 3-inch curb or down one safely too, so that's pretty interesting. And it goes through sand and dirt pretty well. We tested it out at the hot air balloon in the field and basically just went off-roading, and it does pretty good. Kind of bumpy, but I'm going to try out this new one. Supposedly has better suspension. It's got the gold shocks, so you know it's good. But it's just a new one they want me to try out. It's a different brand, and they're trying to get used to it, or they're learning too, so it's a little quirky, like controls and stuff. But they're just trying to settle upon this. They give you a bunch of demo chairs here because they have to order your discharge chairs, 4 to 6 weeks before you leave. So you've kind of got to settle on something that you're comfortable with, and then they would custom order them because they do come fitted to the individual, and that's really important to get the fit right. So fit not good on this chair, but that's not what they're testing. They want me to test out the drive and the suspension and see what I think. So we shall test it this weekend. What's that?
We're shooting today.
Oh, shooting guns today. Pellet gun range apparently in the basement, so we're going to go down there and shoot. And doing a bunch of preparation for a surgery that I've got, an outpatient surgery here at the clinic in urology. They basically are going to change catheters. So I will go from a standard, what they call a Foley brand catheter, which is interurethral or indwelling. So it's basically they leave the catheter in your urethra for up to 30 days, and then they change it, and then that's it. So it drains into a leg bag. Now the suprapubic is basically, it's above my pelvis. They cut a small incision, and then they insert a catheter line through there. There's no bleeding. There's no way that you can get infected, basically, and it also will save on wear and tear on the urethra or potential for infection. So they scheduled that. They said it would take a while to schedule, but it actually just got on my schedule for next Tuesday or Wednesday, whatever day the 30th is. So that kind of came up as a surprise. So doing a bunch of tests, getting ready for that, just making sure I don't have any infections or my heart is good. And they're going to take me off of any blood thinners and any pain meds basically before that, but that's not a big deal. The only one that I'm sad about is they're taking me off of the Voltaren gel for my neck and my shoulder, which is basically like old man cream. It's pretty magical. It's a topical painkiller, but they'll get me back on it after surgery. And the surgery will help because you don't have a catheter line. It can get kinked between your legs and bunched up and stuff. So that's pretty routine, and we're trying to figure out what that's going to be long term for me. So that's coming up real soon.
What for at breakfast?
Carrie's going to get breakfast. And there she is with my jam. Peach jam. Thanks, Sandy.
Yes.
Very good. People can try. I have put in a request for some low sugar jams to go with my toast and cream cheese in the morning. That's one of my favorite things to go with coffee. I got another really busy day, so I figured I'd do this really quick. I've got an 8 o'clock in-room, they call it ADL, which is Activities of Daily Living, ADL. Which is another acronym to throw around, but that means like they help you try to learn how to brush your teeth, comb your hair, shave your face, put on your socks, get dressed, take a shower, clean catheter, go to the bathroom. All these things that you don't really, you kind of take for granted until you get injured like this. But now I have to relearn it because of lack of mobility, obviously, in my hands and my legs. So there's a bunch of little steps and tips and tricks and then adapted tools that they give you. So, for example, I've got the toothbrush. I think I posted a video of me brushing my teeth, and it just has a hand strap on it, and I can strap it to my hand, and I have enough motion and strength already to brush my teeth and then, turn the sink on and spit. So it's a lot of just adapting. You don't just get to go home. This is what they used to do. They just send you home and figure it out. But that was 30 years ago. Now it's like they have a plan. They send you home with special equipment to get into the shower, to go to the bathroom on, I call your commode chair. And, tools to pull up your socks, tools to wipe your butt, just the list goes on. But it's good because, they do this with so many people. That's the advantage of Craig. And it always amazes me that they can discharge people in 2 to 3 months in my condition that come in. So December 5th is still what they're targeting as a discharge date. My fingers are crossed that I get a little more time so that I get a little more pool therapy, because I haven't been able to get in the pool because of the skin sore I have on my backside, and that is a bummer because pool therapy and is supposedly everybody that talks about, everybody that gets the first time they get in the pool, they're ranting and raving about it. They say it feels really good. It stretches all your muscles and takes a lot of pressure off your back. Your legs, kind of the people who have spasming legs like me right now, my leg muscles and back muscles will spasm just erratically as I lay in bed. They'll straighten, they'll kick, they'll move side to side. So, that is just the muscles, kind of their way of exercising themselves from not getting too stagnant. But you get in the pool, and then all of a sudden the water moves them around, and they have pressure against them, so it helps blood pressure, and I'm so ready. It's been 4 weeks already. 5 weeks since injury today, 5 weeks since injury yesterday, 4 weeks at Craig today. Oh no, yesterday. Today's Thursday. Time's flying by. It's good. Things are happening quickly. Uncle Bob came by and visited me from Milwaukee. One of my dad's brother-in-laws. He was just out here hunting mule deer and trying to hunt elk. But like the rest of us, he found a mule deer and not an elk, and was headed back through. So he stopped in and said hello and dropped a t-shirt off for me. I didn't think he knew what to expect, but I think he left here pleasantly surprised and kind of in awe. So he got to see the Peak Center in full swing when it's busy and people are on all the machines, the walking machines, and in the pool. And so, yeah, that was good. Thanks for stopping, Uncle Bob. Aunt Jamie, I hope you do better. I know she's been struggling with her MS, so I know what you're feeling. It's hard to describe what it means to lose mobility, but hang in there, positivity. It's been a good life, no doubt, but there's still lots of good tools, and you just got to keep working, keep her moving, as they say, or I would say it anyways. Sorry, getting a little misty. Dad's in Milwaukee for his best friend's son's funeral, so wishing them the best. Again, a scary time for them. And if you get a chance, check out my YouTube channel. I just put a video on. I got probably the coolest present I could have expected from my hockey friends, some of my hockey friends. There's a lot of them, I guess. But the Tuesday morning, Thursday morning private reservists, as we called ourselves, private reserve was basically like a morning pickup, and it was an organized scrimmage, and it was a great group. It is a great group, and I look forward to coming back to at least be with them, maybe play and skate again someday. But they brought me, or mailed me, a stick. Watch the video. It blew my mind. I was just like, what the heck is in this giant box? I just came home from class yesterday or the day before, and it was sitting in my room. So we opened it up, and sure enough, inside, I was like, it said John Roach on the front. So John, obviously, is a hockey friend. And I was like, what would they send me? I had no idea. I wasn't expecting anything. But Doug King is a woodworker in Missoula, and a really stand-up dude. A great hockey player, too. Fun to play with if you ever get the chance. Doug handmade a wooden hockey stick. Left-handed, nonetheless, too. And then everybody autographed it. And it's hanging on my wall. So I would love to say I could play with a wooden stick. But, man, it's way too nice. So thank you, guys. That's really awesome. Glad you're all thinking of me. I miss you much. And I miss the hockey rink. And winter time is my favorite. And that's one, hockey and skiing. I look forward to hearing about it. And I look forward to getting back to it someday in some capacity. So keep it up. Keep the traditions going. You guys are going to have to find a way to play without me. Somebody to take my place, because until I get back, somebody's got to carry it on. Keep a good attitude. Have fun on the bench. Especially in GHL, you guys. This is where I'll get on the soapbox for all of the 35-plus players this year. If you're watching this, you guys should go to the draft because you learn to play together. You know, we are 30, 40, 50 years old. We can get out of our comfort zones. It's fun to play with somebody new from time to time, because when I joined the league 3 years ago, I just signed up and got randomly put on a team with some of the best people I've met on the rink, and I've gotten to know so many more since, and I've had a great time. Even despite the fact that we've won 3 times, being three-peat, the Goats are probably one of the most formidable teams ever to play hang loose, if I do say so. But I did actually plan to defect from the team this year, despite not telling them yet. But I had been pushing the league directors and all the other captains to try and do a draft this year. I think that the guys in Whitefish do it really well. They mix it up every year, and they have a lot of fun, and that's what it's about. So it's not about the cup anymore. It's about playing hockey, and when you can't play hockey anymore, like me, you'll remember that. So get out there, have fun, make some new friends. And all the guys that are joining 35-plus this year, and the newbies, just get onto whatever team you get onto and make friends and hang out, and, you'll get to know everybody else in the league, and pretty soon you're playing against all your best friends too. So that's the advantage of it. So that's my soapbox for today. And that's probably a good place to stop, because Laura Henning, the league director, or I think she's president of Maha, league president, is coming here today just to pay a visit. She's in town. So, of course, I'm going to put a bug in her ear about the draft again. So watch out. I am still going to be spreading my positivity and my influence from afar, because I love you guys. So thank you. I need to get breakfast down before my 8 o'clock. They're going to try and dress me today again, and there's some more grooming stuff. I mean, of course, Lord knows I could use a lot of grooming. Look at me. Got all that hair yet to work with, but I'm always just interested in finding new tools and stuff like that too. So, yeah, still working on that old man shoulder, and that's been a good challenge, and I'm getting a lot better in the manual wheelchair, so watch out. I was looking at a titanium unit with Spinergy wheels yesterday. They are fast, so it'll be fun. I'm really liking that. That's there's a lot of freedom that comes from being in that littler chair and the lightweight chair, so that I can get in and out of a car and people can take me places. So soon, it's happening fast. And the busy weekend. Chris Benning is going to be here. My friend Gus has been spending a bunch of time with me. He's been really helpful, so thanks, Gus. He's been watching Bodie. Brandon's been in Las Vegas, having a good old time on the Harbor Freight dollar. And I miss you, Brandon, and I'll see you soon. And everybody else that's been getting on my calendar, I got a lot of people coming in and reaching out, so thank you. If you guys can get here during the week, that is really when your mind will be blown. It's a good time. Just to see the Peak Center in full swing and see all these people, these amazing spinal cord injuries and brain injury people as they work, because I'm just an average dude here. There's a lot of people that got a longer road and have been working a lot harder, and there's people who have rolled in here in a bed who I've already seen walk out. So it's a cool place. If you get a chance, come on down to Craig Hospital. Woo! Happy Thursday, and you guys have a good weekend if I don't see you before then. All right, take care.